I think we're just at about 12:30, so we will get started. I'm Brad Newman. I'm one of the advisors and certified financial planners here at Fort Pitt Capital Group. With me is Nathan Boxx, who is Director of Retirement Plan Services here at Fort Pitt. And we're going to spend about an hour chatting with Jason Seltzer, who is a specialist in employee benefits at Engle-Hambright Davies, or EHD. Excuse me, about the impact of health insurance during the COVID. So first of all, I'd just like to say that all of us here at Fort Pitt Capital Group are pleased to present this series of webinars. This is not just a one-off. It's a whole series. And for those of you who might not be familiar with our firm, these webinars were really designed, with that in mind. They were designed to be educational. They were designed to touch on a lot of the areas that are really important to our clients, and to leverage the expertise of the advisors that we collaborate with all the time, so that as we're navigating these types of issues, we're oftentimes not the expert, but we know the people to bring in. So with that being said, let's just touch on a few housekeeping items. If you'd like to be interacting with us on an iPad or an iPhone or some sort of a handheld device, down at the bottom there are options for getting the handouts, options for asking questions. And if you're on a computer, if you go up to the top, there's a little orange arrow that will bring up a button for questions, and we will do our best to answer questions as we go. We have some that are pre-submitted, but anything that we're not able to get to, we're going to follow up with you directly after the seminar. So with that, let's kind of jump in. And Jason, I think probably one of the most common questions that we've seen or heard is, what has the pandemic, what has the COVID done to healthcare spending, and what's the long-term prognosis, based on the pandemic or the COVID?
Sure. So before we start, I just wanted to take a minute to say thank you to Brad, Nathan, and everybody at Fort Pitt Capital for giving me this opportunity to chat with everybody today. And I hope that all of you find this to be a very informative and enlightening demystification of a lot of things healthcare related. So, the topic on everybody's mind in life, and specifically in employee benefits, is, what has COVID-19 done to healthcare spending? And so we have seen in talking with our actuaries that healthcare spending this year is down anywhere from 40 to 80%. So when you look at the number of routine claims that we would expect to see in a given calendar year, those are down fairly significantly. Now, it's worth noting that shock loss claims, if you're familiar with the term, shock loss claims are what we would refer to as high dollar claims, and the threshold there varies, whether it's a claim over $25,000, over $50,000, but shock loss claims really haven't been affected all of that much, which makes sense. If just because we're in the middle of a pandemic doesn't mean that people who are in the middle of cancer treatments or in the middle of dialysis or higher cost medical conditions aren't getting the care that they need. So those claims haven't really been affected all of that much, but I'm sure, even personally, I've delayed a number of routine care items that I've had on my agenda, specifically because there really wasn't any reason to put myself out there to go get a physical in the middle of a pandemic. And so what we've seen is those types of claims are down significantly, meaning the overall spend for most health plans, regardless of your funding arrangement, is down significantly. The prognosis from what we've been seeing is the fourth quarter of this year is starting to see an uptick again. And again, in your own lives, you might be seeing this as well. You're starting to return to your, getting your physicals or getting your annual checkups and more routine type of care now versus April or May or June of this year. And the actuaries are projecting that that's going to continue into Q1 of next year. And at some point there will be a correction. There is a fear that the delay of routine care can in some ways inform higher cost medical issues. And so by delaying that care, we're delaying the diagnosis of higher cost issues that aren't going to rear their heads for another 6 to 12 to 18 months. So hopefully that's spread out over the next year. And so we don't have kind of this one shot where we start to see everybody start to go back and the claims go through the roof. And they're not really projecting that from an actuarial level. So the good news is, depending upon how you financed your health insurance this year, your claims should be down significantly. Hopefully that has led to a more reasonable rate of increase or possibly even a decrease. And so
in premium.
Yes, in your premium and in your renewal of your plan. Unfortunately, for people who are in a fully insured arrangement where they're paying the insurance company and the insurance company's managing everything, that really hasn't been the case. They're using this as kind of a way to build up some reserves and make up for some losses that they may have had in years past. And so the increases haven't necessarily been passed on to the end user in all instances.
Great. Excellent, thanks. So Jason, even with unemployment being somewhat elevated, I continue to hear from folks that we work with that it's hard to find the talent that they want and keep the talent, that it's still a competitive place for to find people on your team. And I know when we are working with companies on their 401k plans, we want to make sure that the offering that we're giving to employees is competitive and a meaningful benefit to the employees, to attract and retain the talent that you need to move your organization forward. What should organizations be doing today to make sure that their plan is attractive and competitive?
Sure. So, as you said, earlier this year, unemployment reached its highest level since the Great Depression. I think it capped out around 14%. And over the last 6 months, due to combination of any number of things, it's down to about 7% currently, which for perspective is still about double where unemployment was on a national scale this time last year. So while it is still higher than what we would have historically been accustomed to over the last few years, it is decreasing. And what's interesting is if you look at the industries and how those are impacted by the unemployment rate, it's very disproportionate depending upon what type of industry you're in. So, service industries, production, blue collar, contracting, construction types of industries have been hit at a much harder level and are still having a much higher level of unemployment than white collar professional jobs, where they've been able to adapt a little bit more easily to remote work, and their jobs haven't necessarily been stalled as a result of the economic downturn and the jobs downturn. And so what that means is, depending upon the type of organization that you have, benefits play a very different role in the attraction and retention of the employees that you either have or want to have and ultimately keep. I have a couple of statistics here I'll throw out. There was a user study done a couple of years ago that said that 41% of employees will look for a new job with better benefits. So if you're looking at how do we retain employees, 4 in 10 of your employees right now are actively looking for a new job where they are looking to get better benefits. Better benefits can be a kind of broad term, and obviously anytime we talk about anything being better or worse than something else, it's very highly subjective. So we don't want to necessarily paint with a broad brush, but the important thing is there is a perception among each and every employee that you have of your benefits package, and if it is what they would consider to be good or whether they would consider it to be not good. And it is often only when you look outside of your organization, or you have an independent person like myself who can give you a third party, an independent evaluation of how you stack up to your competitors and what are your competitors doing that is working or not working, or different strategies that you can use to make your benefits package more attractive. Another statistic that I think is pretty interesting is that of those 41% of employees that are looking for a job with better benefits, 57% of younger workers, so we'll categorize as, I believe it was 35 and under, are looking.
Okay, so none of us.
Yeah, exactly.
Thanks, Nathan.
So, you know, if you tend to be in an industry that has a lot of younger employees, they are a lot more mobile. They have a lot less, you know, employer loyalty, if you will, and they are actively looking for jobs with better benefits. They make up currently 40% of the workforce globally. So we're talking about over half of employees that make up 40% of the workforce right now, on an average, are looking for a new job with better benefits. That's staggering when you extrapolate that outwards for your organization. So the question becomes, what role does benefits play? Well, according to a SHRM survey, and if many of you may be familiar with SHRM, it's the Society for Human Resource Management, healthcare is the single highest valued benefit amongst employees universally. 95% of people who responded to their survey said that healthcare was the most important thing after salary to them. Unfortunately for Nathan, retirement plans were a distant second at 71%. But all joking aside, you know, we're in our industry, we're kind of constantly trying to balance the cost of benefits, which, you know, historically has tended to increase year over year over year at a pace significantly higher than inflation, with employees who look at the benefits plan and see that and go, in larger and increasing numbers, I'm going to look for another job because my benefits aren't as good as they used to be, or they're less affordable than they used to be. And so how does an employer balance those things, and understanding that the benefits are that important and the employees value them as much as they do, yet they're paying more and more and more money for them, and unfortunately, oftentimes cutting benefits as a result to help maintain some control over costs. So, you know, there are a number of things that can be done. I think we're planning on talking about some of them. You know, how do you enhance your benefits package? How do you look at ways to control costs? You know, rather than looking at this as just a reactive kind of scenario, how can you get more proactive and you know, make this an attraction and retention tool rather than just a line item on your P&L?
So, Jason, while we're talking about costs and trying to make an attractive package, what role can voluntary benefits play for companies to, you know, offer a more robust, you know, offering while still trying to be sensitive to their costs?
Absolutely. So right now, as far as the products, if you will, of the employee benefits sphere, voluntary is the quickest growing area right now, and largely because of what we just talked about. You know, employers are saying, all right, I have a defined amount of capital that I can put towards this benefits program. So if I can't put any more money into this scenario, what else can I do? And what's interesting, and I think what a lot of people don't realize, is that employees value benefits whether the employer pays for them or not. And that's where the voluntary or work site programs come into play. You know, you can allow an employee to pick and choose what is best for them at their own expense. And not only do they view that as part of a more comprehensive offering, but it also gives them the ability to get coverage that they need or want at a much more attractive price point and with much more attractive features than they could get if they were to go out and buy it on the open market. So just as a quick example, you know, if this was National Life Insurance Month, I would have those statistics, but I didn't get those. But, you know, there's some number that, you know, the vast majority of people in the United States have little to no life insurance or are significantly underinsured when it comes to life insurance. The life insurance marketplace for an individual person not only requires a significant amount of, medical underwriting many times, and sometimes financial underwriting, depending upon what you're buying, but you're getting a program that not only has more restrictions on it on the front end as far as your ability to qualify for that life insurance, but it's also more expensive when you get it. And so by offering a voluntary life program, you're giving something to employees that they more than likely need. You're giving it to them with the ability to get coverage regardless of their medical conditions through guaranteed issue amounts. And you're doing it through payroll deduction more often than not, or depending on what amount they're buying, you're doing it after tax. But still, you're paying a group rate as opposed to an individual rate, which is going to be significantly more affordable. So employees do find value in that. They like the fact that they can buy something that they can't necessarily go out and get on their own, or they can get it at a much more attractive price point. And, because I wanted to be prepared, I got a couple of statistics on voluntary benefits, but as I said, it is compounding 5% a year for the last 10 years in terms of growth. So 5% year over year compounded growth in voluntary benefits. 2/3 of employers offer 3 or more voluntary benefits. And of those, 25% of those offer 6 or more. So when you think about voluntary benefits, it's as basic as a voluntary dental or vision or life insurance program or a disability program, but the voluntary marketplace is expanding exponentially. I mean, we've got pet insurance, we've got whole life insurance, we've got group home and auto insurance. I mean, critical illness. I mean, you name it. The virtual marketplace of benefits is becoming your oyster, because you can get any and everything you could possibly imagine through a voluntary program. And employees are not only looking for that, but they're increasingly starting to expect that.
Makes sense.
So Jason, when we're talking about costs and being able to manage them, when I'm evaluating, an independent advisor or broker like yourself, do I just go with whoever can offer me the lowest rate, or along the like, are you guys are all brokers the same, or am I missing something here? Or maybe explain, talk about that a little bit.
Sure. So I'd be lying if I said that I didn't hear that far more often than I'd care to admit, and I'm sure you guys probably hear that the same as I do. What's interesting is this is the single biggest misconception in my industry, is that not only are all brokers the same, but somebody's just going to get me a lower rate. And I think that misconception is born out of a fundamental misunderstanding of the differences from a business owner or management perspective between the way commercial insurance works and the way employee benefits work. So commercial insurance, which is your workers' comp, your general liability, your property policies, et cetera, those are very much influenced by who your broker is. Because of the way that market works, certain brokers have access to certain carriers. Certain brokers, because of the amount of business that they do with a carrier, will be able to get you better rates than a different broker. And so there is this mentality that, well, if broker A can get me this rate, broker B can go to a different market because they're bigger and get me a lower rate for the same product or for a more attractive product. And that's true. I mean, that is how that market can work. That's somewhat of an oversimplification, and I put a big disclaimer out there that I am not licensed to, or do I know a whole lot about commercial insurance, but I know enough because, one, my company does that, but also because I know that we're the exact opposite in the employee benefit space. So there's 2 main things that are worth noting. If you are an employer who has under 50 full-time equivalent employees, you are subject to the Affordable Care Act guidelines, and you're also subject to the Affordable Care Act regulations. So there's 2 important things to know about that. One is the law requires that all plans are made available to all buyers of those plans at the same price, regardless of how they're bought. So if you have 48 people and you call me and say, I want to buy a Blue Cross Blue Shield health insurance plan with a $1,000 deductible, I'll say, here's the plan and here's what it costs. I can't change the rates. I can't change the plan design. I can't do anything. If you call a different broker and ask for the exact same plan, they're going to give you the same plan with the same rates because the law requires it. And to make matters even more confusing, if you go directly to Highmark or Capital or Independence or Anthem or whoever, and you buy an ACA plan, they're going to charge you the same amount as if you had bought it from me or somebody else. That's just the way the market works. So if you have less than 50 people and you're buying a fully insured plan, there is absolutely no variability in the plans or the price at all. And so when you call a broker or a consultant and say, is there any way that you can get me a plan with lower rates? Either they're lying to you or quite honestly, they don't understand how that market works, quite frankly, because it's the law. I mean, that it's as black and white as that. Once you get over 50 employees, there is some variability in the plan designs, in the cost. You know, if we're talking about multiple financing mechanisms and everything else, we can kind of go down a rabbit hole here that I don't want to go down at this point.
A whole other webinar.
Yeah, that's a different webinar. But the point is insurance companies, and I know because I used to work for one, have a policy where if you get the same information from multiple brokers, they get the same quotes. Now, do all insurance companies adhere to that 100% of the time? Not necessarily, but the way the market is designed is that if you send me a particular group of information with your plan designs, your employee count and everything else, and you send that to somebody else and we both send it to Blue Cross, you're going to get the same proposal from both of us because they don't want to get in the middle and be the arbiter of which one of us gets your business. They want it to be determined off of other things. So the one thing I will say is if you call up somebody and you ask them to get you a lower rate for benefits, it's not going to happen. It can't happen. There are ways to get you lower pricing, but just getting a quote from another carrier is not one of them. And so what I would say though is, so if you can't get me a lower rate, what's the difference? Why do I want to work with you versus somebody else? And so there's a handful of questions that I would say that you should ask your broker or ask of yourself and determine what are you actually getting? Because I can also tell you that in addition to this being the biggest misconception in our industry, the other biggest misconception or the biggest thing that I hear is I'm really happy with my broker. And then I start to ask them questions that are fairly basic. And I start to find out that while they may like their broker's a nice guy, their broker takes them golfing, you know, whatever it may be, there are fundamental flaws in the underlying benefits program that have created liability for the employer, that have created compliance issues, that have gaps of care, you know, all sorts of things. So here's a few questions that I would ask myself. You know, do I consider my broker to be an advisor or a vendor? If your broker's a vendor, all they're doing is they're bringing you quotes every year. There's no strategy, there's no long-term plan in place. It's the same thing every year. And we hear that a lot. Here in Western PA, I get UPMC, Highmark, and United Healthcare. And those people think those are the only options that exist. There's many others out there, but many brokers don't either know about them or use them. So are they just slinging product, or are they there to help work with you to help you take your business where it needs to go? Second question, how responsive are they to service issues? We hear this very frequently, that people say, I have been calling my broker to get this question answered, and they either won't do it or can't do it.
I only hear from them at renewals, right?
Exactly. And not only that, and this is another question that I would ask myself is, when do you hear from them? Because are you hearing from them 6 weeks before your renewal date and they're going, here it is, what do you want to do? You know, that's no way to run your business, you know, but we hear that a lot. How confident are you in the recommendations that are being made? Are you being reactive or proactive? Are you taking what they're giving you as gospel and just running with it? Or are you pushing back and challenging them and saying, okay, what else is out there? Well, or is there any other things that we can explore so that when you do make a decision at your renewal, you know that you did it with all of the information that you needed, all the supporting information that you needed, and it's putting you in the right place for the next year, rather than 6 months from now, you're going, man, I really wish our renewal would have gone differently. I just, we didn't have time, or our broker didn't give us a whole lot of choices. What is the long-term strategy? What is your 3 to 5 year strategy? Most people say we don't have one. We hope to have insurance in 3 to 5 years. That's not a strategy. That's a wish. So you should have a strategy. And what conversations have you had around bending the cost curve? Because like we talked about at the beginning, costs continue to go up. They're going to continue to go up. That doesn't mean you have to take it as a universal acceptance that it's going to continue to go up. There are things that you can do to challenge that and to put yourself in a better position, but is your broker advising you on that, or aren't they? And how willing are you to challenge the status quo to make yourself and your company, put yourself in a better position?
Jason, you're really preaching to the choir. I mean, that's kind of how we approach things with our clients. And there's a lot of the same issues in our industry. I only hear from somebody when they want to sell me something, or sometimes I don't hear from them at all. But kind of going back to the cost control, one of the things we keep hearing a lot about is HSAs, or health savings accounts, as a means of controlling cost. Also self-insurance and things of that nature. What are, from your perspective, kind of some of the pros, the cons, the advantages, the pitfalls of some of these things that are, I don't know if HSAs are newer, but it seems like they've been around for a while, but maybe not quite mainstream.
So I preface my comments on this subject with a big qualifier, which is any or all or some combination of all of these different things will work for some people some of the time. So I don't want it to come across as me being, none of them work, don't use them, don't ever talk about them, because that's not the case. And there's a place for everything. What I would caution the attendees to be very aware of, though, is that in our industry, because there is this attempt to find the silver bullet, what is that one thing, that one idea that's going to fix this? And so we keep, every few years we get a new silver bullet, and when that silver bullet comes out, the vast majority of the brokerage community is out there pushing it and selling it as quick as they can. They don't understand it. We don't have a track record to know how well it works, and many times it ends up backfiring, and we see this time and time and time again. So I preface this by saying all of these can and are solutions to various problems, but it is not a one-size-fits-all approach. And so that's important. The one thing I will say, I'll talk about HSAs first, because HSAs tend to be the most common of all of the things that you had mentioned. And, again, there are places for health savings accounts. But what we've seen, and I'll refer to some of the handouts here, that cost of contributions for both employees and employers has gone up significantly over the last 19-20 years. And that's one of the slides from the Kaiser Family Foundation that I would encourage everybody to look at when you have a moment, if you haven't downloaded them already. The other thing is that deductibles have increased 8 times as fast as wages have since 2008, 2009. So over the last 10 years, they've gone up 212%. So what that is indicative of is the prevailing wisdom for HSAs in particular was, if we make employees a better consumer of healthcare, it will ultimately drive down cost. And the best way to do that is using a health savings account. And again, that can work. And there is a whole industry around health savings accounts that wants it to work and is trying to facilitate it working. Unfortunately, what we've seen as an industry as well, if we're willing to be open to it, is that a lot of people were recommending moving to qualified high deductible health plans with HSAs simply as a way to save money and to transfer the risk to employees from the employer. And so I'm going to pull out a few more statistics for you because I'm a visual guy. So when those decisions were made, employers were not giving a lot of consideration to whether or not their employees could actually meet the deductibles the plans were rolling out for them. So according to the Kaiser Family Foundation, 49% of employees have no financial way of meeting their deductible. That's terrifying. And from your guys' perspective, you know, we're talking about either personal financial accountability or, you know, retirement planning, where we're seeing, and I don't want to speak for Nathan here, but you know, we've been seeing much higher plan withdrawals to help cover out-of-pocket costs. A lot of those are medical costs. People are going back and saying, where do we pull money from because we've got this $5,000 deductible that we have to meet. We also did a study by Willis, a former employer of mine, says 43% of employees don't contribute to their HSA. So when you look at the financial implications of a health savings account, a lot of people can't afford the deductible that they have. And most people aren't putting any money into the health savings account, which effectively makes it not exist. If there's no money in the account, you can't pull from the account. So how effective a solution is that? So
Jason, just a quick question. My understanding was that in lieu of the high deductible with a much lower premium for the employer, they were going to put money into the HSA for you.
Yes.
And so, is that not happening?
It is. However, I want to word this carefully. The employers who were given good advice and who chose to seed the HSA accounts, most of them did so and continue to do so because they understand this aspect of it. They understand that if they don't do that, that this is just a ticking time bomb waiting to explode. Unfortunately, we've seen many employers who aren't seeding the account, or who will say, you've got a $3,500 deductible, Brad, here's $500 in year one, and we'll give you $250 in year two, and you're on your own for the rest. And you blow through that in no time. So again, it can work if you seed it properly, if you have a plan to continue seeding it over time, if you educate your employees on how the HSA works, if you educate your employees on their ability to open a health savings account, what they can do with that money, they can be successful. But when you're simply using it as a way to defer cost and defer risk, and especially in lower income scenarios, what we find and what we've seen, and I have a few more statistics for you, it leads to people not getting care. And so we've seen this in the example that I use all the time, because we've seen it. When people have health savings accounts that are not funded, they defer care. So the Journal of Oncology did a study showing that patients who have health savings accounts forego routine care twice as often as those who don't have health savings accounts. A SHRM study shows that 30% of employees with HSAs delay care inevitably, and with no real plan of ever, you know, getting the care that they need. And so what does that look like in practice? So we've seen examples where an employee has a cold, you know, routine cold, no big deal. Well, they have an HSA, they don't want to go to the doctor or the urgent care because they don't want to pay $150 rather than a $20 copay. So they don't go to the doctor. Well, they don't get any better, and then they end up with the flu. Well, they're sitting there going, it's just the flu, I'll be okay, it's not that big of a deal, I'm not going to go to the doctor. Well, they get worse, and then they get pneumonia and they end up in the hospital. And now, rather than going to the doctor for a $150 office visit and maybe taking some medication, now they're in the hospital with tens of thousands of dollars of expenses, and they're paying the full boat of their health savings account as a result. So the deferral of care that happens in HSA plans that are not properly set up and not properly planned for is a significant problem. And we have seen anecdotally that health savings account plans, when married with non-health savings account plans, have gotten higher rates of increase than the non-health savings account plans for that very reason, because you're saving money on the lack of routine care, but you're more than making up for it in the high cost claimants that you see because of that deferral of care. It's just a simply, it's a cost shift. That's all it is. So, that's HSAs. So what about a few other things? I'll hit on a couple of others quickly. Again, we could go into a deep dive on all of these, but reference-based pricing. Reference-based pricing is the hot button silver bullet right now. And can reference-based pricing work? Absolutely. Really quick, what is reference-based pricing? All it does is it says, we're doing away with networks, and we are going to negotiate every claim on your behalf, and you hire a third party to do this, obviously. They provide you with a cost for a procedure that they have negotiated with your provider. And the idea is that it's based on a percentage of Medicare. So, right, that's great. If the hospital is accustomed to getting Medicare rates for something, and you come in and say, we'll pay you 150% of Medicare, should work, right? Makes sense. Well, it's not quite that simple, because in certain areas, the negotiated rates for private insurance are vary greatly depending upon where they are and what their percentage of Medicare is. So in some parts of the country, private health insurance pays 400% of Medicare. So if you want to go in and negotiate 150% of Medicare, they'll take it all day long, because, well, it's not as much as they were getting from private insurance. It's still way more than they're getting from non-private insurance. In Western PA, we're seeing very little reference-based pricing. And if you talk to the reference-based pricing providers, they'll tell you they can't sell it in Western Pennsylvania for two reasons. One, we get the health insurers here have a much lower rate of reimbursement relative to other parts of the country. We're at about 150 to 200% of Medicare here. So there's not enough spread to make it worth their while, number one. And number two is UPMC won't accept it. And what ends up happening is you have a provider who refuses to accept a reference-based pricing arrangement. You have the potential for something called balance billing. And balance billing, again, that's a whole other conversation. But suffice it to say, if you go in for care and your reference-based pricing plan says we're going to pay X, and the provider says we want X plus $30,000, guess who's on the hook for the $30,000? You are, not your employer. Well, unless your employee turns around and sues you, which we've seen, and they say, hey, I didn't know I was going to have to pay $30,000 for this. You told me you were going to negotiate on the front end and I was going to be fine. So it's either that or the employee has a $30,000 bill that they have to deal with. And so we're seeing lawsuits all across the country where people are being balance billed for reference-based pricing plans because they were told that they would have this determined on the front end. They go to get care and they find out after the fact that they owe a bunch of money and they're not happy about it, as you can imagine. So again, can it work? Yes. Is it the silver bullet that some people are making it out to be? No. A few others real quick. Self-insurance, again, fully insured, you pay the insurance company, they take all the risk, but they keep the profits. They also take the losses. Self-insurance can exist in any number of ways, but there are protections against catastrophic claims, but in theory, you pay for what you use. If you use less, you save money. If you use more, you pay more. Again, not a one-size-fits-all approach. It's very highly dependent upon utilization. I have gone into many groups where they have horrible utilization and people are saying, hey, I talked to this broker and he told me I need to self-insure it. I'm like, why? You're going to spend more money that way because your claims are terrible. But again, it's this one-size-fits-all silver bullet approach that we have in our industry. Captives, all captives are the next level of self-insurance where you're sharing a layer of risk with a captive on your stop loss insurance, which allows you to possibly save more money. Another one, and this is the last one I'll touch on because this is the newest one, is the ICHRA, which is the Individual Coverage HRA. This went into effect January of this year. It was an executive order by the Trump administration, and effectively what it does is it allows the employer to say, we're not offering health insurance anymore. We're taking a bucket of money and we're setting it aside. And we're going to hire a third party who's going to confirm that all of our employees go out and buy individual health insurance plans. If they want to buy a good plan, they buy a good plan. If they want to buy a cheap plan, they buy a cheap plan. But we commit that we're going to give everybody X amount of dollars towards their individual health insurance. They can do it on a tax advantage basis like they can a group plan, but it allows the employer to get out of the business of these are the plans, these are the renewals. It's this is how much money we're spending and you guys do what you want with it. So can that work? I've seen it work for large employers who have a lot of, quite honestly, retail is very big in retail or service industry, where national chain restaurants have lower wage employees all across the country. And rather than buying an expensive, national plan and paying claims all over the country, they just say, all right, for anybody who's working at a retail level, we're going to take this ICHRA, we're going to give you $500 a month towards your insurance, have at it. So again, those are just some of the tools at your disposal. But again, my biggest caveat with any of those is if someone comes in you and tries to push you in any one of those directions, you should very much be skeptical, because nothing is that simple. and these should all be a progression of you accepting more risk as you become more comfortable with that process.
Makes sense.
Thank you. I'm going to switch gears a little bit here on you, Jason. I know back in the old days, we used to be able to have get everyone in the same room together and do an enrollment meeting and talk about the plan and your options. Obviously in today's work environment with working remotely and COVID restrictions on gathering large amounts of people in a small confined space, what are our options now for doing kind of enrollment meetings so that people are informed about the decisions that they need to make with regards to their coverages? How do we handle that now?
So the one thing I would definitely caution people against is abandoning the employee education portion of your open enrollment period, because whether it's due to COVID and people being spread out, or the fact that you've never really done that sort of thing, Nathan's idea of the way things used to be is true, but not for everybody. There's a lot of employers that didn't really place a priority on open enrollment meetings. I always have, and I think everybody should in some capacity, because it's the one opportunity that the employees have to really get an understanding of what their options are and get questions answered, rather than just picking something off a piece of paper. But what I would say is, employee benefits technology is becoming far more available. It used to be more of an enterprise level solution for larger employers. It's really moved downstream to the fact that a group of 15 or 20 people can still get a fully blown benefits administration platform. And there are various ways to pay for that, and it's not always an added cost either. But when you have employees that you can't get together for any number of reasons, if you've gone to a virtual or remote workforce, or 73% of people have smartphones now, which sounds both extremely low and extremely high. I think it's low because it's taking into consideration everybody, and I'm sure there's a lot of 98-year-olds that don't have or need smartphones. But I think if we looked at working population, it's much higher than 73%. So we're accustomed to shopping on our phones. We're accustomed to doing why not have our benefits enrollment on our phones? We can sit at the dinner table with our spouse, talk about what our options are and the costs are, and it doesn't have to be a piece of paper where any person on this call who's an HR person has gotten a form back from somebody that goes, I don't know what my kid's social security number is. Oh, we can't put your kid on the plan without your social security number. Or you didn't sign page 3 of the form, we need you to sign it or else they won't accept it. And you got to send it back to them. And it's such an antiquated way of doing things. And for anybody who is trying to maximize their efficiency, especially in the human resources area, offloading a lot of this open enrollment and ongoing plan administration stuff to a technology platform will not only make you more efficient, but it will also make the employee experience a lot better. Because like I said, we as a society are accustomed to doing things this way. Yet when it comes to open enrollment, it's, you know, here's a stack of papers and good luck.
Jason, as you're talking about that, I'm kind of thinking back to the first part of our conversation about how transitory employees are and how likely they are to move from employer to employer based on benefits they do or don't get. It kind of struck me that that annual enrollment meeting was a really good venue maybe to, you know, tout to the employees and participants what great benefits you have. How does that work kind of in the virtual world? I mean, how do employers go about doing that today?
So that's a great point. And so there's two things that I would say is, for a while there was a period where total comp statements were a big deal, because there was this feeling that, well, maybe if we let people know how much money we're actually spending on them and their benefits, that they'll appreciate them more. So we got these software programs and they put these nice pie charts together and how much money we're actually spending that you don't see. And I think that was effective, but I don't know that it necessarily solved the problem of value. It brought to the surface the cost of things, and it made people aware that there was a cost for things. But what it didn't do is it didn't necessarily create value in the end user. They just now know that you spent, you know, $7,000 on their PTO. Well, you didn't spend $7,000, but that's the accrued, you know, value of their time off. They don't care about that. You know, that doesn't, they don't value that anymore now that they know what it's costing you to let them take a day off. So what these platforms now will allow you to do is they're extremely customizable. So you as the employer can create content or pull from content from partners to put on the website that will say, hey, welcome to open enrollment. We're really happy you're here. We wanted to talk to you about some enhancements that we made this year. We also wanted to remind you, and part of the process of going through open enrollment on a platform is you're reinforcing what benefits you are offering that don't cost the employees any money. And typically it's the life and the disability programs that don't get a whole lot of utilization, but there's a cost associated with that. And most people don't even remember, oh yeah, I've got $200,000 worth of life insurance through my employer and it doesn't cost me any money. Well, now's your chance to reinforce that. So I think that anytime you can put your benefits into a vehicle that will reinforce not only what benefits you offer, but the value of those benefits to the employees, then it's putting you in a better position as an employer, and it's putting your employees in a better position too, because at the end of the day, there's a significant disconnect between what employers think employees want and understand and what employees actually want and understand. And employees go in and might say, hey, our employees love our benefits, they're great. And meanwhile, they're going, I don't know what a deductible is, but I signed up for a plan with a deductible, so we'll see what happens. And then we find out later that employees weren't actually happy because they didn't understand how the underlying plans worked. And so open enrollment is a chance for you to inform, educate, and solicit feedback from your employees to make sure that they appreciate what you're offering as much as you appreciate offering it to them.
Yeah, and I think that those conversations are certainly going to, you know, engender more loyalty to your employees, right? If they feel that, hey, I've got a great employer that offers me, you know, these great benefits, health insurance, you know, retirement plan and compensation and PTO, all that together. If they I believe that if people fully understand the complete package and that it is a true benefit to them, that they're more likely to stick around. Which is
absolutely. And two, you can't discount the, I call it the point of sale experience either, where, you know, somebody comes on board, you onboard them, they come in, the onboarding process is, hey, well, welcome to the family. We're happy to have you. Let's roll out the red carpet and everything's wonderful. And then it's, here's your benefits. And it's like, all right, well, I got to enroll in my benefits. And you have these warm feelings about your employer. You're happy to be there. You enroll in your benefits. And then when you go to use your benefits, you didn't understand them when you signed up for them. And then you're at the doctor, you're at the pharmacy, you're at the hospital, and you're going, I didn't understand that this is what I signed up for. And you don't sit there and you go, oh man, I should have paid more attention during open enrollment. The feeling is my employer didn't tell me what I should have known, or didn't inform or educate me well enough to understand this. It's their fault. And so that's why we try to work with employers to let them understand, yes, it's dollars and cents. Yes, it's about the product and the network and the deductible and all that other good stuff. I mean, we have to have those things, but we can't lose sight of what the employee experience is like, because if they have a bad experience down the road, it's going to reflect back on you as the employer, whether you did anything wrong or not. And so we need to put systems and processes and solutions in place to make sure that we minimize that as much as possible. And this is one way to do that.
Jason, can I maybe ask you two questions that were submitted? These are COVID related.
Sure.
One is, how will ACA calculations need to be done for people who took themselves out of the workforce to self-quarantine? And then the other is, I think they're saying they need medical coverage for 1 year until Medicare kicks in. Their husband needs it for 2. Oh, I'm sorry, that's not a COVID, that's a COBRA. The other COVID is, I guess, COVID-19's impact on expanding or shrinking the Affordable Care Act. Does that drive us to a single payer? So I guess they're both COVID and ACA wrapped together.
So I'll answer the second question first. When we were planning for this meeting, I made a comment to Nathan and to Brad that I was going to steer clear of political topics.
I'm sorry.
That's okay, because this
People
is
have spoken.
The truth of it is that this is a highly, if not exclusively, political issue. If you are a believer that the Affordable Care Act as an entity should not exist, if you believe that it has had a negative effect on our healthcare system and our health insurance system, and you want to go back either to the old way of doing things where there was no ACA, or the opposite of that, which is you would like to go to a single payer plan, either one of those decisions is inherently political. What I will say is, my understanding is that, again, and it's funny we mention this right now, because right now there's Supreme Court hearings for a nominee that will potentially be hearing arguments for the abolishment of the individual mandate, of which would essentially destroy the foundation of the Affordable Care Act and make it completely useless. So with that as our backdrop, and the fact that we have a presidential election going on, I think I would look at it one of two ways. And it's less about COVID and more about what happens in the election. If the current administration stays on board, and or they have the ability to nominate a conservative justice to the Supreme Court, and they choose to neuter the Affordable Care Act, what will happen is we will have a reversal back to a time where we had pre-existing condition limitations on medical insurance. The individual marketplace will become almost unattainable for most people who need it. And insurance companies are not going to be incentivized financially to take on riskier people. And so what does that look like? Where do those people go? Remains to be seen. If, on the other hand, if Joe Biden were to win the election, he has come out and said, either as a talking point or as a actual policy, that he has every intention of moving towards a single payer system. And so to not answer the question, but I really don't think that COVID has any real bearing on what the future looks like from a global health insurance and healthcare perspective. I think far more so it's what ultimately happens with the Supreme Court nomination process and what ultimately happens with the election in November, because nothing's going to happen between now and then. Those two things will have a far greater impact on the Affordable Care Act than anything else. Brad, if you wouldn't mind, would you remind me of the first question?
Yeah. How will the ACA calculations need to be done for people who took themselves out of work to self-quarantine?
That is not necessarily an easy question to answer, because the question is surrounding ACA calculations. There are a lot of ACA calculations. So I can't necessarily answer the question exactly as it's currently worded. What I would say is that the laws that were passed earlier this year have very clear guidelines for offering coverage both to employees that are active, employees that are, and employees that have been furloughed. And as that has or has not continued over time, those guidelines are still in place. Those guidelines will also continue because they are based on something called the, I don't even remember what the correct terminology is, but the infection period or something like that, and that is ongoing. So those regulations are still in place. As far as the calculations surrounding the Affordable Care Act, that could mean anything from, you know, I have an employee who was either furloughed or was laid off and came back, and I need, how do I calculate them for purposes of the Affordable Care Act full-time equivalency calculation? How is Centers for Medicare Services going to calculate ACA rates for next year based on all of the change in the workforce that we've seen? There's a lot there. So without knowing exactly which calculation we're talking about, I'm not sure. But I would say, you know, I know we are also running up on time here. If the individual would like to reach out, I would certainly be happy to get back to them on a one-on-one basis as well.
Perfect. And I know we've got all of our, you know, bio information here with contact info. So that's fantastic. Nathan, is there anything else on your list that you wanted to see if we could squeak in?
Hey, Jason, just real quick, I want to revisit the conversation we had earlier about small employers, and we'll couch that as 50 lives and less. And you kind of alluded to the fact that there's not much that you can do there, but is there, very quickly, are there some small or relatively easy things, or what should people be thinking about for those folks that fall into that bucket?
So I would say, and this applies to what we would call small groups, but I would also say that it even more applies to larger groups. But the first and most important thing that anybody can do, regardless of size, is challenge the status quo. You know, if you've seen the same thing for the last 3 years, there's more out there. Make sure you're exploring what else is out there, because you may have 20 employees, you're trapped in the ACA market, you think there's nothing out there. There is. There are opportunities for you to explore alternative funding. There are opportunities for you to gain control of data. And quite honestly, unfortunately, we won't have time to really talk about data, but data is the single most powerful thing that's happening right now in the employee benefits market. And putting yourself in a program, whether you have 20 employees or 200 employees or 2,000 employees, to get some or better data surrounding your utilization will make, that is the only way that you will be able to get a control over your costs. And you know, when you're fully insured with less than 50 people, not only are you not getting any data, you're not getting any flexibility, you're not getting any options. So see what else is out there, see what options exist, see what other mechanisms you can explore that will not only give you different venues, but also give you the ability to try to get some of that data. And then once you have that data, do something with that data, because like I said, that is where real change can happen. You know, there's a common over-the-counter drug. If you get it at one pharmacy, it's $6. If you get it at a different pharmacy, it's $70. So extrapolate that concept outwards. You know, if you're, as an employer, paying for a hip replacement in one place might be $15,000. At a different place, it might be 45. Is there any reason to do the 45 versus the 15? You don't know if you don't have the data. And so, along with exploring what other options exist, explore what options will give you access to data, and then use the data that you have access to make better informed decisions.
Good stuff. Thank you.
Yeah. Thank you. And I think kind of with that, we'll wrap things up. I did want to, again, thank Jason, thank you for participating. The information you gave was fantastic. You know, really, really good stuff.
Thank you for
being, yeah, thank you for being willing to chat with people after the fact. Hopefully everybody enjoyed today's webinar. We hope the content hit the mark. I did want to just put a plug in. As I mentioned at the beginning, this is really a series of webinars, not just a one-off. So we do have one coming up tomorrow at 12:30 on savvy Social Security planning. We have one November 19 at 12:30 on everything you wanted to know about retirement, but we're afraid to ask. That'll be interesting. And one on charitable gifting strategies, December 3rd at 12:30. So I believe we can sign up for all these at our website, fortpittcapital.com. And with that, I'll just, again, thank everybody for their attendance, and I hope everybody has a great rest of the afternoon.
Great. Thank you.
Thanks, everybody.